There's over 5.2 million Victorians for coming on and getting on with the vaccination journey. Even more impressively, 76.5% of Victorians aged over 16 have now had their second dose, are now fully vaccinated and able to look forward with real confidence to the opening up, which we're on track for this Friday, and being part of that fully vaccinated community and economy. 24,180 vaccines administered yesterday at our state hubs, and we are seeing those numbers start to drop. It's not unusual, it's kind of what we'd projected in terms of the number of people still to come forward. But we still have literally hundreds of thousands of Victorians who are eligible, just under 500,000 who have not yet had their first dose. And they're in real danger of being left behind. And I'd encourage and implore anybody who's not yet made up their mind about whether to get vaccinated, please come forward and get it done. Talk to your GP, talk to your pharmacist, talk to us, talk to your friends. Look at all the things we're about to open up over the weeks ahead, and please come and join the rest of us in this vaccinated world. We have 748 people currently in hospital with COVID-19. It's a slight reduction on our recent 7-day average, which is encouraging. 138 of them are in intensive care and 87 are on a ventilator. And we send our very best wishes to everybody who's in hospital and recovering from COVID, and everybody at home who's either isolating or recovering with COVID, as we know the effects can be longer lasting. Sadly, we have 13 Victorians who have passed away with COVID in the last 24 hours, or reported in the last 24 hours, including a man in his 30s, a woman in her 40s, 4 men and a woman in their 60s, 2 men and 3 women in their 80s, and a woman in her 90s. Of course, we send our deepest condolences and thoughts to their families at this really difficult time. There were 83,210 tests processed yesterday, which is another record number, a fantastic result, and really important at this time as we enjoy the benefits of last weekend and the opening up and the far busier streets and cafes. Really encouraging to see Victorians continuing to come forward to get tested at the onset of symptoms, and that's how we keep these COVID safe practices. This is how we keep ourselves safe over the weeks and months ahead. Out of those 83,000 tests, 1,534 positive cases of coronavirus, of which 226 were in our regional settings. We are seeing, it's been reasonably encouraging to see the 1,500 number. We've seen it now for a few days. It does feel like we're sort of at the at a plateau at the moment. The plateau is higher than we'd like, but it is in line, in fact, slightly under the Burnett modelling at this point in time. But we are seeing an increasing trend of cases in regional communities. So the share of cases every day, 17% again today, of cases in regional communities is increasing, and frankly that's what we expect to see over the weeks ahead as we start to reduce restrictions and we start to move around more across our state. We now have 24,164 active cases of coronavirus in Victoria at this point in time. Can I just welcome the announcements made this morning by the Therapeutic Goods Administration around the approval of Pfizer booster shots 6 months after second doses for everybody aged 18 and over. That's a really important step forward. We're very keen to be getting on with that booster program. We're obviously ready to assist and to support that rollout across Victoria and in fact across Australia. We are now eagerly awaiting Otago's advice and the Commonwealth's decision on how this will be done. But our clinics, our local public health teams, all of our vaccinators are standing ready to get on with that program. Of course, the vast majority of people are well under the 6 month since their second dose, so this is not an immediate thing for the vast majority of us. But there are 69,000 Victorians currently today that we're aware of where it's been more than 6 months since their second dose, primarily residents of aged care and healthcare workers. So we'll be very keen to move on with the booster program as soon as we get the green light from Otago and the Commonwealth. I'm also really pleased to announce, or pleased to see the news from Coles and Woolworths around their planned deployment or planned sale of rapid antigen tests from the 1st of November, from next week. We've been using rapid antigen tests within our testing systems now for a number of months, certainly within some of our hospital emergency departments, also for some of our hospital visitors, including the children's. We're doing a trial at the moment with a small number of schools, and of course we've used it in some of our major construction projects. I'm also aware that many organisations, particularly larger organisations, are using rapid antigen testing as part of a screening tool for their own workforces and have been doing that with good effect for some time, including of course some of our distribution centres. So we're very, very pleased to see this development. It will provide, along with the clearance for people to use rapid antigen tests at home, so without clinical supervision. That's also possible from the 1st of November, and it becomes another good tool in the armoury for all of us to have as a way to deal with the risk of COVID in our community. Of course, they complement, they're an additional measure. So anybody who is using a rapid antigen test, it's a great screening tool. It's great to use on a regular basis to see if you're becoming positive. It's obviously great to use if you think you've got symptoms. But please, if they turn positive, you must get a PCR test. You need to get a PCR confirmatory test of any positive rapid antigen result. And of course, our entire network of over 200 testing centres remains available for you to do just that. So it's a good step forward. And again, it's another way for us all to manage our risks more locally, but still to be part of keeping COVID under control in our society. We've also got, of course, with our vaccination programme, we continue to push on with our school pop-ups at the moment. So we have another 6 running this weekend. So again, I'd encourage particularly communities in around Laverton College, around Craigieburn Secondary College, Doveton College, Lindale Secondary College in Dandenong, Hume Central Secondary College, and Creekside College in Caroline Springs. They'll all be running vaccination pop-ups this weekend. If you live in those areas and you haven't yet been vaccinated, or if you live in those areas and you want to get your second dose, then please come forward and get them done there. Or of course, any of the other state clinics, or the literally hundreds, no thousands of pharmacists and GPs around the state that will continue to help you get vaccinated over the days and weeks ahead. And again, it's sobering to see that of the cases we reported yesterday, 85% of those people were not fully vaccinated. Of the people in ICU, 95% are not fully vaccinated. And we still have, as I said, just under 500,000 Victorians who have not yet had their first dose. And we are, if we look at our Burnett modelling of where we expect case numbers to be, although we expect case numbers to maybe ease off a bit, hopefully over the coming days, we are expecting them to rise, and they will rise amongst the unvaccinated. The cases are affecting over 2/3, or 85% in fact on yesterday's numbers, are impacting those who are not fully vaccinated. That is the group that is most at risk. And if you are one of those 500,000 people, particularly kind of call out people in their 20s, where we are seeing a lower take-up of vaccine at the moment, with only 83% of those in their 20s having had first dose, we really want to encourage you now to get vaccinated. The rest of us are not going to stop. We are going to move on. We're on track for 80%. We're on track for 90% later in November. But we do want to take everybody with us and make sure they've got the protection of the vaccine at this point in time. Finally, for those of us who are vaccinated, remember we can still catch and pass on the virus. It's just the impact on us and the impact on our health is so much less. So therefore, please keep checking yourself for symptoms. And as we start to move around more, particularly from Friday onwards, and particularly as Melburnians can start to enjoy travelling to regional Victoria again, please be aware that we will see more people with symptoms, and we'll see more cases moving across our state. So if you do have symptoms, please get tested. Please get tested swiftly, and isolate and monitor for any, wait until you get your test results. And if you are positive, again, help us all out. Get the information out to those people you've seen recently. We're all about to go through a phase of seeing a lot more people, more social contacts, back at work, back in other settings. So please, if you are testing positive, do your bit and let people know that you've tested positive, and encourage them to get a test. We, of course, continue to follow through with all of our contact tracing work. The 99% of people that we contact within 24 hours when they've tested positive, all those disciplines and processes remain in place. But what we find time and time again when we talk to people in our contact tracing interviews, they've already let their friends and family know, people that they've seen, they've let their employer know critically, so people can take the appropriate measures and protect for the onward spread of the infection. With that, I'm happy to take any questions.
The man in his 30s and woman in her 40s in today's deaths, are you able to say whether COVID was their primary cause of death?
I don't believe so, Rachel. I believe that they passed away whilst being COVID positive. I don't think it was the primary cause.
Jeroen, we've heard of people waiting up to 5 days to get the results back after having had a COVID test in regional Victoria. Is the processing system coping with the amount of tests that are being conducted at the moment?
Yeah, absolutely. I'm very surprised to hear that, and I'd be interested in getting some examples of that for you if you wouldn't mind. Look, over 83% of test results come back the next day. So we are continuing to hit really high turnaround, with a high number of cases. We're seeing really good compliance in terms of overall turnaround times. I don't have the 48-hour turnaround time in my head, but it's in the mid-high 90s. So we are not seeing any significant number of cases. I've certainly not heard of any reports of that. So I'd be interested in hearing more about that.
Just on that point, what's the health department doing to, I guess, address the COVID crisis in Albury and Wodonga? We're told that testing sites are at capacity with 1 hour.
Yep.
I think 27 schools have shut in the past 2 weeks. The local MP called for ADF support because he says there's been no extra resources from the health department. Where are we at with that?
Oh, there's a huge amount of work going on on both sides of the Albury-Wodonga border. So we're working very closely with New South Wales Health. In fact, we've got daily incident review team meetings with our colleagues from across both sides of the Murray. Let's be very clear, it is a significant outbreak happening in Albury-Wodonga at the moment. We're reporting, we've got literally hundreds of cases on the Wodonga side of the border. I think around 2 or 3-fold that number on the Albury side of the border. And of course, they're very interconnected communities. We deployed additional testing results up there last week. Those additional testing resources and teams continue to be up there. We're working closely with a large number of schools that have been impacted with students moving around the community and being positive. And in fact, our Deputy Chief Health Officer was in Wodonga himself on Saturday and Sunday of last weekend. So they're on site working closely with the teams up there. So there is a significant response in place in Albury-Wodonga. I appreciate absolutely that there is a busy testing scene up there, and I know our New South Wales colleagues have also put additional resources into their testing capacity. And we've seen this before time and time again with regional outbreaks, is that there is usually a busy 3-day cycle as people respond to the call to action to get tested. I would always urge, and I know we've been doing this locally, anybody who is symptomatic, anybody who is a primary close contact, anybody who's been to those exposure sites to get tested first, and to encourage others to wait a little while. And I'm sure our colleagues in New South Wales are sending out similar messaging.
Do we need to do more up there though? Because obviously testing sites are at capacity, you have to people get tested. Do we need to make it more testing sites in Wodonga?
No, look, we certainly we've put up, I think, at least 2 or 3 additional testing teams up there since last weekend. They'll continue to be in there to support that effort. We'll continue to provide whatever resources necessary to enable people to go and get tested. But my understanding is we're doing literally hundreds, probably thousands of tests a day across both communities, which is appropriate to the size of outbreak that we're dealing with.
Do you think it's necessary to bring in the ADF?
Certainly not from what I'm seeing on the Wodonga side of the border. I mean, there is a significant effort and programme of work underway between Albury-Wodonga Health, obviously our rapid response testing teams, our local public health teams, our additional testing teams we've deployed up there, and of course the huge in-reach vaccination effort that's going on in that community. Certainly of the outbreaks we're seeing on the Wodonga side of the border, it is well contained and well defined within a certain community. We're working very closely with them on that. I don't see this at this point in time as being beyond that, but we'll continue. We're checking in and we're meeting with people every single day. If that situation changes and evolves, we'll put more resources in there if we need to.
Sorry, what community is that, and how many of today's new cases are based in Wodonga? Again, are there vaccination rates at the state level?
Mark, I won't go to the specific community. I'm not sure that's entirely helpful for a statewide conference, but certainly we're working very closely with community leaders on the Wodonga side of the border to see what else we can do to support communities to come forward to get vaccinated in particular and to get tested and to isolate properly. All that work is going on. We are seeing a significantly younger cohort of people becoming positive and moving around the community in that part of the world. Again, that's not unusual at this point in time. We're seeing again largely unvaccinated people who are catching COVID and who are spreading it in their networks, and that's what our action plan up there is around to try and minimise that.
How many cases? Sorry, how many cases?
I don't have that, Mark. I'll put it in the Cho report this afternoon. I don't have it with me, I'm afraid.
In terms of retail, in people that are unvaccinated being able to go in, where do individual retailers stand if they want to actually say, I don't want unvaccinated people coming in? Are they allowed to say that? Are they allowed to stop unvaccinated people coming in?
Yeah, look, I'm not an expert on retail law. I've got a little bit of experience in working in a shop 40 years ago, but it's been out of date, I suspect. So look, I think in all seriousness, the 2 things. One is, I think absolutely I would expect any retailer to be able to set an appropriate framework within their environment about who they serve and who they don't serve. I can't comment on the legality of what measures they can say that I'm going to ban people from coming in. But also, let's look at the momentum we've got at the moment, with 92%, almost 92% of Victorians being first dose vaccinated. I think we're seeing a huge surge of people. The vast majority of the community are vaccinated, and I think it is a we will continue to move towards 90% vaccination levels in a few weeks' time, and also continuing to strengthen the arrangements at that point in time around really requiring people who work within the retail setting, certainly by the end of November, everyone needs to be fully vaccinated, and continue to encourage the wider community to really recognise that if you're not fully vaccinated, it'll become increasingly difficult to take part in all those activities that all of us take for granted.
Does it make sense that unvaccinated patrons would be allowed into non-essential retail for this odd 3 or 4 week period? They're locked out now, they're going to be locked out. Like why when the risk is higher, essentially at 80% versus 90%, are they allowed in?
Yeah, look, I think it's a question of timing and giving people enough time and space to get that vaccination job done. So I think the balance we've had to strike is, do you hold back the opening of non-essential retail whilst you allow...
Open. It's not a staffing issue, I'm asking about the patrons.
Well, no, it isn't. I think the position we've taken is we're giving the community as much notice as possible about saying we are now shifting very assertively towards a fully vaccinated mindset, whereby we expect that if you're going to go into retail, non-essential retail and all other activities we take for granted, you have to be vaccinated. We've made those rules very clearly for Hospo, because we wanted to bring Hospo back as soon as we possibly could, and to bring it back more safely. We've given a bit more time and space for retailers to get back and moving again. I think to the earlier question, we would absolutely discourage anybody who is not vaccinated from going into any of those retail settings. We would absolutely, I think morally support any retailer who wants to have those kind of arrangements in place, and the provisions will be put on the table over the coming weeks to make sure that's the case from the 90% mark.
Why discourage it? Why not just say that the customers who aren't vaccinated can't visit stores? Why?
Yeah, look, I don't think you'd accuse of Rachel of not having enough rules and directions in place over the last 20 months or so. I think our setting on this has been really clear. What people have responded so quickly and so enthusiastically around getting vaccinated. It's enabled us to bring forward the 70% last week. It enabled us to bring forward the 80% opening on the roadmap to this Friday. It's put 90% out there as a point where we can really start to see beyond pretty much most restrictions that we still have in place. And I think as part of that, there's a very clear warning that says we've got, 3-4 weeks to get everybody vaccinated who wants to continue to participate in our wider society. I think that's a pretty fair deal.
It's not an essential, it's by definition non-essential though.
Yeah.
So why allow it for this weird 3 weeks? And then when it's, as Mark was saying, actually safer because the vaccination rate will be at 90%, then ban it. Right?
Yeah, sure. Look, I think at the end of the day, we've set out, and the Premier has spoken to this both earlier this week and I think last week when the announcements were made. We've set out a very bold and very clear trajectory for what it looks like beyond 80%. We've had a very strong focus in the weeks running up to this around what does 70% and 80% look like on the roadmap. We wanted to get the right balance between where do you need to mandate, and we've had a real focus on dealing with those high risk settings, particularly in that kind of hospo and cafe retail pub type environment, and about saying we want to ensure that we get the workforces through that vaccination program. That's actually gone quicker than we probably anticipated. That's allowed us to bring some of those dates forward. We're sending out a very clear signal that says if you're going to be active in these kind of retail environments post 90%, you're going to need to get yourself vaccinated. That gives everybody, even the few 100,000 people we've got left who are eligible but not yet vaccinated, you can start that journey today and you'll be all through fully vaccinated well in time for the 24th of November.
Was it ever really realistic though? I mean, pubs already check people for ID, so that's something that already happens at pubs. But imagine any shopping mall, somebody at every single store in a shopping mall checking every single vaccination, whether they're in for 10 seconds or an hour. Is that really something that we can achieve and something that can be enforced for every single shop all of the time? Yeah,
I think the enforcement of this and how retailers manage this, how shop owners manage this will be largely matter for them. And we'll work with them over the coming weeks to get that right. I think it's worked well in essential retail over the last few months. I think if you look at the way those measures have been introduced, all the way back to what was it, May, when we introduced QR codes as being a mandatory provision, the work we've done with those essential retail settings, and then we broadened it out into other retail settings, actually that's gone really smoothly. Before we went into the 6th lockdown, we had really good activity and engagement rates on those QR codes. That worked exceptionally well. I think we're just extending those principles. We've integrated the vaccination statement thing, or the certificate. into the services VIC app. That's working really well with the QR code. I don't think these are impossible things to do. And if that's the price to open up all these facilities, to get everybody moving around again, and to get rid of all these restrictions, that seems like a pretty acceptable thing to do.
So is it fair to say you're imagining more of a good faith system rather than something that is?
Not in the early days. I think we are. I think there's been a significant shift. I think both in our wider community mindset and the way we manage this pandemic going forward. And the shift has been is that now you've got 91% of people first dose vaccinated, 76% fully vaccinated. You can do more things more quickly, but there's also a much greater sense of we're all in this together. We all want this to work. We all want to get out of lockdowns. We all want to get out of put these restrictions behind us and not have them come back again. So I do think people will take to this with a level of enthusiasm and acceptance that I'm seeing around us at the moment.
Jeroen, just on that mandate, more generally, some health experts have said that Victoria should ditch the vaccine economy from next year once case numbers are brought under control. Do you personally think it's reasonable and fair to lock people out once we've got 90-95%?
Look.
I know Prime Minister today has made similar comments on radio that New South Wales have been able to do this in a safe way. What's your thoughts?
There's a fair bit in that. So I mean, look, firstly, I'm not the Chief Health Officer, so I'm not really best placed to opine on what does that public health environment look like. I think what we've done here in Victoria collectively is we've said the vaccine is the way out of all this, and we want to encourage and ensure, and ultimately, really underscore the importance of people getting vaccinated in order to participate in all these things. What does year look like? What does next year look like? Well, who knows, right? We don't know what's going to emerge over the next 4 or 5 months. We'll look with interest at Northern Europe in terms of what's happening there, in terms of their winter as they go through that sort of setting. We don't know yet what's going to happen around other variants. We want to, in order for us to put all those things behind us, there are things that we can all do. We can all get vaccinated, first dose, second dose. TGA today has finally given us the green, or the amber light at least, on booster doses. We wait for the green light from Atagi and Co. Let's get on with that and get those booster doses done before we get into our next winter in June, July next year. There's plenty for us to go and do and to manage all those pieces and to manage those COVID safe settings and to see how we go over the next few months. In the scheme of that, dealing with a really small minority of people who, for whatever reason, don't want to get vaccinated just isn't that important.
The Premier indicated today it might also be fully vaccinated people who end up getting locked out if they don't get a booster shot this morning.
I didn't listen to the Premier's comments this morning, so I can't really comment on that, Mark. I think what we are opening up today is potential for booster shots. And if the recommendation, we need to see exactly how Atagi and the Commonwealth are going to deal with this. If the requirement is that we all get booster dose, or if the requirement is to be fully vaccinated, we require a booster dose, then we'll absolutely adopt that. We want to protect the whole Victorian community. We don't want to be back in here in this world in May, June of next year, where we're starting to put lockdowns back in again. We want to move beyond this, and to do that, we need to get people vaccinated.
Why would we need to put lockdowns in again next year if we're all 90% double dose?
We wouldn't. But Mark, that's the point. We would not. If we're
You
all
said we don't want to be doing it next year.
Correct.
And you tied it to a booster, is what I said.
Well, if the recommendation from the clinicians is that booster doses are necessary to maintain that immunity, then booster doses will become part of the program.
New South Wales will lift restrictions on unvaccinated people in December.
Yep.
Will we still be checking vaccine passports for people entering the Australian Open? Grounds?
Again, I'm not managing the Australian Open, but the Australian Open will be for vaccinated spectators and for vaccinated participants.
The Premier made it clear that Victoria will not apply for exemptions for unvaccinated Australian Open tennis players.
Yeah.
Is there anything that the state government can do preventing those players coming into Australia via, say, Sydney and doing their quarantine there?
Look, I mean, I think where we end up with this is if you're going to have to go on some kind of dodging countries and states that in order to travel around while you're unvaccinated, you're going to have to go through the load of subterfuge to get to where you want to get to. That almost highlights the point, I think, that says, why on earth would you do that? Why on earth would you go to all those measures and extents in order to do something when you could just get vaccinated and get on with it and be welcomed in and be supported to doing what you're here to do? So, look, we've made our position really clear. I think the Premier made his position really clear this morning. From public health grounds, our position is very clear. We only want vaccinated people at these major sporting events. We've come out the world we've come over the last 20 months, I think, kind of backs that in, that says, we've got a phenomenal experience and traditions here of running amazing sporting events and to running them safely. We're not going to change that now. And, the options are there for people to participate, get themselves vaccinated and to get it done.
Jeroen, you said that people who test positive to a rapid antigen test at home then the
Yep.
need to get a PCR test.
Yep.
Do we need to change the public health orders to make sure that people do that?
I don't think so at this point. I think that we're seeing the rapid antigen test as being a useful additional measure whereby people can take a bit more ownership, a bit more control, and to get better advice about what's happening with themselves and what their own health is. It's a phenomenally helpful tool for that. We're using it really effectively within some of our health settings. We'll start to use it in some of our school settings. Be interested to see how that trial goes. I think they're a really practical tool. I'm not at this point thinking we've got to change our public health directions on this. It remains very simple. If you've got symptoms, you need to get tested, you need to get a PCR test, and then wait for that result.
And on the point of schools, are you going to allow schools to integrate them more into their COVID-safe plans?
Absolutely. So I think we'd be very, we're starting a small trial with schools at the moment around the use of rapid antigen tests in some of their settings to see, how do you adopt it in that particular environment. I think there's a real potential in that trial, and we'd encourage schools to be. I know schools are working really hard at the moment. It's really challenging, opening up for term 4. It's great to see the students back at school again. It's great to have so many doing the VCE today. But schools have a real challenge around how they manage positive cases coming through, and therefore any tool which helps them get a better understanding of who's positive and who's not, and supporting kids who are positive is going to be a good thing.
On schools, is there going to be any change to the way we deal with positive cases as we open up? Is it still going to be primary close contacts quarantining for 14 days, or is that going to shorten?
Well, it's already shortened. So I mean, any student who's 12 and over who's fully vaccinated is only quarantining for 7 days if they've got school or social exposure. So that provision's been in place now for a number of weeks, and that's all part of our trying to find the right balance between how we keep things moving, keep organisations moving, and keep individuals safe. We'll continue to work with schools and with other colleagues around how we best manage those quarantining arrangements, but we're trying to strike a balance here between the evidence that we've got around transmission. We know that as we're seeing more kids come back to school, which is a really important thing, we want to keep them in schools as much as possible through term 4, and of course set up for a really important education year next year.
So you'd only extend that to under 12s if they become eligible for vaccines?
Look, I think that's, we're exploring a number of options at the moment around what we could do with under 12s. Recognising that the best thing from our point of view, as I think I said the other day, is to see that advice come through from the TGA and the Target around what do we do with the under 12s. That's a real question in the minds of so many parents. We've got over 500,000 children between the ages of 5 and 12. I think all of us will be really keen to understand what we can best do to protect them. So the sooner that position is made clear, the better. Okay.
Thank
Good.
you.
Thank you all.